Good afternoon. In today's video demonstration, we will going to demonstrate the routine procedures of the elbow, namely AP elbow projection and lateral or lateral-medial projection of the elbow. Good morning, ma'am. Good afternoon, Darlene. Ma'am, you may sit down po, ma'am. Ma'am, I just want to, by the way, ma'am, I am Jonathan Tulgo Ikoy, and I am your radiologic technologist for today. And may I know, ma'am, what is your language preference?
Bisaya, sir.
Oh, sige, noted po, ma'am. Ma'am, I would like to ask, ma'am, if pregnant pa ka karon?
No, sir.
Kanusta ka last week po, ma'am?
Last week lang po.
Sige, noted po, ma'am. Ma'am, pwede mo ko i-ask imong middle name, ma'am, age and date of birth for just a, ano po ni ma'am, patient confirmatory, to identify that I have the right patient for this procedure.
Ingo, sir. Then 17 years old. Then August 3, 2003 po.
So, take noted po, ma'am. Ma'am, pangayon na pang requisition form. So, ang nasa requisition form, ma'am, is x-ray sa imong elbow. Tama ba, ma'am?
Yes, sir.
Nausa din na imong elbow, ma'am.
Natutod na po, sir.
So, dira ang sakit. Na-injured siya.
Opo.
Sige. So, karon ma'am, sakit pag gato imong elbow.
Yes, sir.
Pero malihok nimo.
Yes.
Sige, noted. So, before ta mag-proceed sa atong procedure, so na dito at ang patient ato ang dressing room, ma'am, pwede narito atong patient gown, which is ang pagsuot sa patient gown, ma'am, is nasa likod. Pero if needed nimo, ma'am, if okay lang, pero sa atong procedure, ma'am, pwede na ito din magamit og patient gown kasi it's elbow lang man.
Opo.
Then, remove na lang po ko sa mga metallic objects, ma'am, like sing-sing or anything. By the way, ma'am, wala man kayo mga surgery, ma'am, no? May aging surgery last time, kanang na kayo mga stimulus sa inyong kamot.
Wala,
Wala,
sir.
sige, noted po. So, final instruction ako, ma'am, is maminaw ta, ma'am, ha, huwag taron kay para madali ta.
Opo.
Sige po. By the way, ma'am, mag-introduce ko sa inyo mga lead shield, ma'am. So, mo ni atong lead shield, ma'am, ang tawag ma'am, gonadal shield, which is ibutang nato siya sa imong lap, ma'am, para maprotektahan imong lap against imong gonads, ma'am, sa radiation kay sensitive na siya. And our thyroid shield, which is ang thyroid pod is sensitive din siya sa radiation. So, butangan na po, ma'am. Then, ang material sa gamiton is cassette, 10 by 12 inches, then our marker. So in today's demonstration, I'm going first to demonstrate the AP elbow, elbow fully extended. So the cassette that we're going to use for this one is 10 by 12 inches. And this procedure is a non-grid, and we are going to radiograph or to image the patient anatomy, the elbow, left elbow. Then, in patient positioning, position the patient seated and the elbow extended and hand supinated. Ma'am, magulit ko, ma'am, ha. Ano mo ito, ma'am? Hand supinated. Then, do not forget to shield the gonads of the patient and her thyroid. Then, ensure that the patient lean laterally as needed for true AP and palpate the epicondyle. So, you need to palpate, make sure that the epicondyle is perpendicular to the IR and the elbow must be centered to the IR. Then, the central ray for this one is, the central ray must be centered or the central ray must be perpendicular and centered to the midline of the elbow or the elbow joints. So, the SID that we're going to use for this procedure is 40 inches or 102 centimeter. So in collimation, collimate on four sides up to the area of interest. So to demonstrate the central ray, which is the central ray must be perpendicular and centered to the mid elbow joint. Make sure that the central ray is centered at the mid-elbow joint. Then, before exposing, make sure to put a lead marker on the collimated exposure field. Then, instruct the patient to do not move. Ma'am, ayaw move, ma'am, ha. Then, shoot. In anatomy demonstration, uh, uh, the medial and lateral humeral epicondyles are demonstrated in profile, as you can see on the sample radiograph. 1/8 or 0.25 inch of the radial head superimposes with the ulna, as you can see. The radial tuberosity is in profile medially, radius and ulna are parallel, elbow joint spaces is open, radial head articulating surface is not demonstrated, olecranon process is situated within the olecranon fossa, elbow joint is at the center of the exposure field, and elbow joint 1/4 of the proximal forearm and distal humerus in the lateral soft tissues are included within the exposure field. So, assuming that this is the radiograph, the sample radiograph is on the left, assuming lang. The next procedure that we're going to demonstrate is the lateral elbow or lateral medial elbow. So the cassette that we're going to use, or the IR, or the image receptor, is 10 by 12 inches or 24 by 30 centimeter. Then this procedure is a non-grid, so we don't need to use a grid for this procedure. Then, in patient positioning, position the patient seated and the elbow flex 90 degrees, shoulder drop as needed to rest the forearm and the humerus, flat table, and IR. And always shield the patient. So ma'am, mag-touch ko ma'am, ha. Ma'am, shoulder drop po tayo, ma'am. Lateral po, ma'am. Your hands. So as you can see, that the elbow is flexed 90 degrees and the shoulder is dropped as needed, and to rest the forearm and humerus flat on the table and the IR. Then center the elbow to the center of the IR to the portion of the IR being exposed with forearm aligned parallel to the edge of the cassette or the image receptor. Then place the hand and wrist in a true lateral position, as you can see. Then the central ray is perpendicular and centered to the mid-elbow joint, and the SID that we're going to use is 40, and the SID that we're going to use is 40 inches or 102 centimeter. And make sure that the collimate on four sides, including the minimum of approximately 5 centimeter or 2 inches of the forearm and humerus. To demonstrate the central ray of the procedure, the central ray must be perpendicular and centered to the mid-elbow joint. Ma'am, wala. Then, do not forget to put the lead mark on this procedure. And do not forget to put the lead marker. And instruct the patient not to move or not to commit in any unnecessary movements. And shoot. In lateral elbow projection, the anterior, posterior, and supinator fat pads are demonstrated as you can see on the resultant image. The elbow is flexed 90 degrees as you can see on the image. The humerus demonstrates three concentric arcs which are formed by the tracheal sulcus, capitulum, and the medial trachlea. So in humerus positioning, distal surfaces of the capitulum and medial trachlea are nearly aligned. Anterior surfaces of the radial head and the coronary process are aligned. In forearm positioning, the elbow joint is open. Anterior surfaces of the capitulum and the medial trachlea are near aligned. Proximal surfaces of the radial head and the coronary process are aligned. The radial tuberosity is not demonstrated in profile as you can see on the resultant image. The elbow joint is at the center of the exposure field. The elbow joint, 1/4 of the proximal forearm and distal humerus, and the lateral soft tissues are included within the exposure field. Ma'am, done na po atong procedure and pwede na po ka ma'am, pero ang result dahil ma'am by the way is 2 to 3 hours pa po siya bago makuha ma'am.
Yes,
Thank you po sa cooperation ma'am.
Yes, sir.